We're going to move on to our next item of business, which is topical questions. And our first question today is from Donald Cameron.
To ask the Scottish Government what its response is to reports that 37 hospital patients were transferred to care homes after testing positive for COVID-19.
Cabinet Secretary Jean Freeman.
Thank you, Presiding Officer. And before I start, can I take the opportunity to welcome Mr Cameron to his new responsibility. Discharge decisions for individual patients are made by clinicians based on each patient's needs. If somebody is discharged to a care home, that should be because that has been assessed as the best place to meet that person's needs. As with other parts of the UK, guidance on discharge and admission to care homes has evolved since the start of the pandemic as our understanding of the virus has developed. Current guidance sets out steps to be taken to ensure patients are screened clinically so people at risk are not transferred inappropriately. Any individual being placed in a care home must be subject to an appropriate risk assessment and be isolated for 14 days. A testing regime is also in place to ensure all care home staff are offered routine testing and that people being admitted to a care home from either hospital or the community are tested appropriately. We've worked to make as much data available as is practical on a range of issues related to COVID-19, and that's why I've today asked Public Health Scotland to work with boards to produce validated statistics and analysis on the number of patients who tested positive for COVID-19 and were subsequently admitted to a care home, and that includes examining how many were assessed as being discharged when they were considered to be infectious and the rationales that were in place for such a discharge, for example, in the cases of palliative care concerns.
Donald Cameron.
Can I thank the Cabinet Secretary for her words of welcome at the start, but I have to say it has taken months for this chamber and the Scottish public to learn that 37 patients were sent to care homes. The First Minister has a broadcast every day and she did not mention it. We only heard about these appalling mistakes that possibly cost lives because of a newspaper investigation, and one which didn't even include responses from every health board in Scotland. So how many COVID-infected patients did this government send to care homes? And more importantly, how many people were infected second-hand by these colossal and potentially fatal mistakes?
Cabinet Secretary.
So the first thing I have to say is that the government did not send people to care homes. These are clinical decisions. We've repeated this, First Minister's repeated it, I've repeated it, our National Clinical Director, our Chief Medical Officer have been crystal clear consistently that the decision on discharge and where an individual goes on discharge is a clinical decision following a risk assessment and in conversation and cooperation with a care home if that is the place to which the individual is being discharged. So it is entirely wrong to say the government sent people to care homes. We did not. What I have commissioned today from Public Health Scotland will provide the degree of data, and that includes across all our health boards. It is for individual health boards to determine whether or not they can respond within the limits of FOI and the cost of FOI, and clearly some boards made a decision that they could not. But the work that I have commissioned from Public Health Scotland today will look across all health boards and will cover that robust, validated statistical output that I've described and the analysis, and will provide additional information about whether the individuals at the point when they were discharged were considered to be infectious, and if they were, what was the rationale for that discharge decision.
Donald Cameron.
I'm afraid the Cabinet Secretary's answers are wholly unacceptable. Nearly 2,000 people have died in care homes in Scotland from coronavirus, every single one of them an unspeakable tragedy. The Scottish Conservatives wrote to the Lord Advocate weeks ago, but we still haven't heard if he will investigate. Why do 2,000 bereaved families not deserve answers? And does she agree that a public inquiry into this scandal should start immediately?
Cabinet Secretary.
So it's not for me to comment on the Lord Advocate's area of locus, simply to say factually, as I would have hoped the member would know, that the Crown Office has set up a unit to look at deaths in care homes and to receive information and investigate where they consider that to be appropriate. And they will get on and do that job independently, as they should. The First Minister has been clear, as indeed have I, that in due course there should be a public inquiry into all aspects of the handling of this pandemic, including, and importantly, on care homes, including whether the guidance that was produced at various stages was appropriate and was implemented based on the information and evidence we had at the time, and whether that guidance was properly then updated as new evidence emerged based on growing understanding of the virus, which is, of course, new. So I think these questions have been answered. There can be no doubt that I and this government take very seriously the situation in our care homes, but I hope there is equally no doubt that we have at all times acted with the best of intention and based on the information that was available at the time that we acted.
Thank you. A large number of members want to ask questions on this issue. Neil Findlay to be followed by Emma Harper. Neil Findlay.
Thanks, Presiding Officer. Is no one accountable for this public health disaster, which I believe is neglect? The reality is they couldn't get people out of hospital quick enough. Couldn't get them out quick enough. And these were people, many of them, who had been in hospital for months and months, long-term delayed discharge cases. This was not about the best clinical care. It was about clearing the decks of all those elderly people, our loved ones. Cabinet Secretary, who is responsible for this?
Cabinet Secretary.
So I have to disagree completely with Mr Findlay on this. I would never, ever, ever be so offensive as to describe clinical decisions as clearing the decks. I would never, ever undermine the professionalism, the skill and the compassion of every single one of our clinicians working in our health service, and indeed of those in our care homes who are also party to those decisions about whether someone is admitted from hospital or not. And I really do wish Mr Findlay would not characterise individuals in that way. I have been clear that in terms of the decisions that I have taken as the Health Secretary, I am accountable. This government is accountable for the decisions we have taken throughout this pandemic. And in the proper time, a public inquiry will look at all of those decisions and will judge whether or not they think we took the right decisions based on the information we had at the time in the right way, updated that accordingly, and whether or not the guidance and the decisions that we took were implemented appropriately. That is the right way to do this. What doesn't assist anyone is to impugn the motivation of those who work in our health service and those who work in our care homes, all of whom are doing the best possible job that they can.
Emma Harper to be followed by Alison Johnson.
Thank you, Presiding Officer. I'd like to ask the Cabinet Secretary if the Scottish Government is aware of any similar issues of hospital patients being transferred to care homes after testing positive for COVID-19 in other parts of the UK from early on in this outbreak.
Cabinet Secretary, just briefly, Cabinet Secretary.
So the answer to that is yes. And in the four-nation discussion that I have with my colleague health ministers in the other three nations of the United Kingdom, we have had discussions around this issue and around the guidance and the updating of guidance. And across the United Kingdom, we have wrestled with these challenges, as indeed individuals and our counterparts elsewhere in Europe and elsewhere have wrestled with these challenges. I will write today to my colleagues in Wales and Northern Ireland and in the UK government, Matt Hancock, setting out what I've asked Public Health Scotland to do and asking them to consider also initiating a comparable exercise so we can look across the 4 nations of the UK and learn from that, as well as having comparable data across the country.
Alison Johnson, to be followed by Alex Cole-Hamilton.
Thank you. In its response to this issue, Scottish Care said there has been a breakdown in relationships between hospitals and the care sector, as the eagerness of hospital discharge has resulted in individuals being placed in care homes when it was clear they needed nursing rather than residential care. So how does the Cabinet Secretary respond to this statement? What will she do to repair and strengthen and support these relationships? And what will she do to ensure the relationship between the care sector and the hospital sector is an equal one? Thank you.
Cabinet Secretary.
So, the first thing I will do in response to what Ms Johnson has said is ask Mr McCaskill from Scottish Care why, in the very many meetings that he and I have, he has never raised that difficulty directly with me. And I will then seek to understand what it is that concerns him in that and what together he and I can do to resolve that matter. In terms of looking forward about what we can do to ensure that should there have been a breakdown in the relationship between an individual hospital and an individual care home, that both understand their responsibilities. The care home, of course, has a responsibility to be confident that it can receive a resident into its care and meet that resident's needs, and if it doesn't believe it can, then to be clear that it cannot, and other alternative care needs to be found for the individual until the care home or another care home is ready. But in terms of looking forward, Mr McCaskill is very helpfully and productively part of the recovery group, which is working with me and a range of other stakeholders on how we not only remobilise our health and social care services, but how we ensure that the proper lessons are learned from the early days of the pandemic and the proper planning is in place should we see an upsurge in cases as we enter autumn and winter.
Alex Cole-Hamilton, to be followed by Monica Lennon.
Thank you. Presiding Officer, I find it unbelievable that all these months later, the Scottish Government still don't know the full extent of this tragedy. This is a devastating revelation. We now know that the government was accelerating the movement of COVID-positive cases into care homes, while at the same time the international community was screaming about asymptomatic transmission. We didn't know how the virus was moving around in our hospitals, and our care homes had no PPE. When the Cabinet Secretary talks about lessons learned, does she recognise the only way that this Parliament and this country will learn those lessons is it under an independent public inquiry that she must commission now?
Cabinet Secretary.
I believe I've already answered the question about the public inquiry. We have been clear, the First Minister has been clear, that there should be a public inquiry into every aspect of the handling of this pandemic, and that when the time is appropriate, the First Minister will commission such a public inquiry, and it will carry on and it will do the job that it's supposed to do. The one other thing, though, I have to say is to correct Mr Cole-Hamilton with respect to PPE. PPE in our care home sector is the responsibility of the private, independent and public sector providers to acquire. When we knew on the 19th of March that their private supply lines were experiencing difficulty, NHS and our National Procurement Service stepped in to ensure there was direct supply in volume and quantity to care homes of the appropriate PPE, and we continue to do that where that is necessary and will continue to do that for as long as it is required by that care home sector and other sectors of our health and social care.
Monica Lennon.
Thank you, Presiding Officer. I've listened carefully to the Cabinet Secretary, but I am disappointed that she's using the clinicians as a shield rather than take responsibility for her government's guidance. Care staff, who are by majority working-class, low-paid women, were ringing the alarm about safety in care homes at the very beginning of this pandemic. And before the pandemic hit, the government was well aware that there was a crisis in social care, especially in many private-run care homes that had had really bad reports from the Care Inspectorate. So why was it deemed safe to discharge COVID-19 patients to care homes that were not able to keep them and other residents and staff safe? And does the Cabinet Secretary now accept that any patient with known COVID-19 should not be discharged to a care home setting with other vulnerable people? And does she not regret acting sooner on the concern of care staff and their unions?
Cabinet Secretary.
So I dispute completely that I am using clinicians or anybody else as a shield. I have said more than once in this chamber, and including today, that for the decisions that I have taken, I am accountable. But what is clear from the 13th of March guidance issued before we were in full community transmission of this virus, that says very clearly patients discharged from hospital should be screened clinically. That is not me that screens them. That is clinicians that screen and have those conversations. That is a simple statement of fact. It may not suit the argument that Ms Lennon wants to promulgate, but it is a statement of fact. And you would not want, I am certain that patients would not want me or any other politician to be screening them. That is not our job and not the job that we are qualified to do. So I'm not using clinicians, I'm not using care home staff, I'm not using anyone as a shield. I am clear about my accountability, but I am also clear about the facts of the matter. And that includes that from 2012, care homes were expected to abide by the National Infection Prevention Manual, which includes basic infection prevention and control measures. We assumed that was the case. The Care Inspectorate has a role in ensuring that is the case. The guidance and the additional guidance and PPE that we introduced was additional to that to deal with this pandemic. And of course, as Ms Lennon now knows, patients are tested or residents are tested before entry into care homes, whether that is from the community or whether that is from hospital. So that is a step to ensure that no one who is COVID positive is entering a care home unless there is an agreed clinical reason between the hospital or the community and the care home that that is the best place for that person to be. And in those circumstances, as with others, they should be isolated for the appropriate length of time.
Graham Simpson.
Thank you, Presiding Officer. The fact is the Cabinet Secretary today has been hiding behind clinicians. She's repeatedly used the phrase clinical judgment. She is effectively saying it was down to them. If people thought it was okay to send patients into care homes having tested positive, that is because of the guidance that was issued. Why will she not take responsibility for that?
Cabinet Secretary.
Quite simply, Mr Simpson, because you were wrong. It's a very, very long time since I had clinical training. I am not shielding behind clinicians. I'm not using clinicians. It is a statement of fact. Clinical assessment, whether it is about delayed discharge, whether it is about what happens to someone who pitches up at A&E, whether it is about their treatment unsuspected of cancer, are clinical decisions, and rightly so. And I will defend that on and on and on and support clinicians in taking those decisions. That is what they are qualified to do. That is where their expertise and compassion lies. That does not mean I am not accountable for this government's decisions in these matters. It is a statement of fact, and I'm very sorry that you don't like it.
Thank you. Moving on to question 2, Beatrice Wishart.
To ask the Scottish Government whether it will provide an update on the return of schools and the number of pupils and staff who have tested positive for COVID-19.
Presiding Officer, as a direct result of the collaboration between all partners and the commitment shown by the public in adhering to the measures in place to suppress coronavirus, I can confirm that the vast majority of our schools were able to reopen as planned last week for the new term. This was a significant milestone in our recovery from COVID and a recognition of the importance of having our children and young people back in school. Being back at school is not, however, the same as going back to normal. School life will feel very different for pupils, parents and staff. Regrettably, there are now a number of community clusters of coronavirus cases among school children and young people. As far as we can determine, In all cases, the transmission relates to out-of-school activities rather than transmission within schools. As a result of the community transmission and to protect others, affected pupils and staff have been asked to self-isolate. Managing this situation is exactly why we have implemented a series of measures under our enhanced surveillance and testing programme for our schools. The surveillance and testing is an essential component of our joint planning to ensure a safe welcome back for pupils and staff. This data will provide important information on levels of infection in our school communities. Finally, I would also like to confirm that the severe weather last Tuesday night meant several schools were unable to open due to storm damage. However, by Monday the 17th, yesterday, only one school in Aberdeenshire remained closed, and I am glad to report that it has reopened today.
Beatrice Wishart.
I thank the Cabinet Secretary for his answer. I've been contacted by parents wondering whether the right precautions are in place, and the EIS has today called on the Scottish Government to do more on school safety. Young people are used to wearing face coverings into shops and on public buses. So will the Scottish Government now mandate the wearing of face coverings on school transport too?
Cabinet Secretary.
Presiding Officer, the Government has worked closely with our local authority partners and with professional associations and other stakeholders in formulating the guidance that has been issued to all schools in relation to the reopening after the summer break. That guidance must be followed in all circumstances, and within that guidance there are a number of measures to mitigate any risk that is experienced by young people and staff, and to create a safe environment for all. So it is absolutely vital that that guidance is followed at local level. I have made clear to Parliament before that the Government will continue to review the guidance that is in place to ensure that it remains appropriate for the challenges that we face. The EIS have written to the Government with the suggestion about face coverings. We will take further clinical advice in relation to that point, because the guidance is consistent with the clinical advice that we have received to date, and further discussions on that question will be held by the Education Recovery Group, which is responsible for the production of that guidance.
Beatrice Wishart.
There is a logic to wearing face masks on school transport. Pupils who get a Lothian bus, a first bus, or indeed in Shetland a ferry to and from school have to wear masks. It wouldn't pose an impediment to children's education in the same way wearing a face covering in a classroom would. The Scottish Government's been clear that this is about balances and trade-offs. So wouldn't face coverings on school transport be a sensible precaution to help minimise transmission and help allow schooling to stay on track?
Cabinet Secretary.
So the first point I would make is in relation to the final comment that Beatrice Wishart made about keeping schooling on track. And I want to reiterate one of the points that I made in my answer, that on the basis of the information available to us today, although there are some pupils who have tested positive for coronavirus, there is no evidence to suggest that any of that transmission has happened within schools. That has all been about community transmission, which provides me with the opportunity to reiterate a fundamental point that community transmission and the suppression of community transmission is crucial to maintaining the opening arrangements of schools. Now, in the clinical advice that we have taken, the view has been expressed to us by our clinical advisors that the dedicated school transport should be considered as an extension of the school estate in which there is no mandating of the wearing of face coverings. That question is, I appreciate, a significant question for a number of stakeholders, not least of which the EIS, and I assure Parliament that we will be taking further advice on this question, and will discuss it with the Education Recovery Group to ensure that we can properly address any issues of concern to pupils, to staff and to parents as part of the safe resumption of schooling in Scotland.
Thank you. Jamie Green to be followed by Ian Gray.
Thank you, Presiding Officer. I accept that the response to an individual pupil testing positive is for that individual to go home, isolate and test and protect measures will kick in. But the biggest fear that many parents have is that if large numbers of teachers and school staff themselves test positive and if school transmission occurs. Can I ask the Cabinet Secretary what preemption has been done to ensure that there are adequate staffing levels within schools so that whole schools or classes do not have to revert to blended learning or reduce face-to-face contact? How many additional teachers have actually been recruited in these past few months? And if he doesn't know the answer, why not?
Cabinet Secretary.
Well, the answer is held by local authorities who are currently doing the recruitment, because as I have had to remind Mr Green on several occasions before, the government doesn't recruit any teachers. The government is putting in place the resources to enable the recruitment of 1,400 additional teachers into the schools of Scotland. So we'll wait to hear from our local authority partners who have the democratic responsibility for the recruitment and the statutory responsibility for the employment of teachers at local level. Now, obviously, we've put those resources in place to try to boost the school teaching population to address exactly the issue that Mr Green has raised with me. So I hope that will reassure him that the appropriate action has been taken to address the issues that he raises with me.
Ian Gray to be followed by Patrick Harvey.
Thank you, Presiding Officer. I'm sure colleagues will, like me, have been contacted by parents of children living with conditions such as diabetes who have returned to schools where few, if any, pupils or teachers are wearing face coverings. These parents just cannot understand why their sons or daughters are protected in supermarkets by everyone wearing face coverings, but not protected in classrooms. I hear what the Deputy First Minister says about the clinical advice, but I cannot for the life of me explain to these parents the logic of it. Could the Deputy First Minister have a go?
Cabinet Secretary.
The logic of the advice, which is, of course, published advice, which Mr Gray asked us to do and which we have done, sets out that the risk of transmission amongst young people is judged to be very, very low, and that providing staff are maintaining physical distancing from pupils within schools, the risk of transmission between and amongst staff, and of course the physical distancing exists also amongst staff within schools, provided these rules are being followed, then the risk of transmission in schools is low. So that's the foundation of the advice that we've had. But as I said to Beatrice Wishart in my earlier answer, the government is taking further advice from our clinical advisors that will be reflected on by the Education Recovery Group, in which all of our stakeholders are participants, to make sure that we can address the legitimate issues that Mr Gray raises. And I should also say that there is, of course, the need for young people who have perhaps been shielding if they have diabetes to have their circumstances individually assessed by individual schools to be assured of their safety.
And Patrick Harvey.
Thank you. I recognise that the phrase school cluster can be thrown around a bit too much and is ambiguous. It doesn't necessarily reflect whether infection of pupils has taken place in a school or in the community. But the government does seem to be relying on the assumption that infections of pupils will reflect community transmission and not drive community transmission in the future. It would be too early to have picked that up already, given how recently schools have reopened. And none of us want to be in a position in a few weeks or months of realising that the judgment was just a wee bit wrong. I've also heard from teachers who share the concern that Ian Gray was talking about from parents and pupils. They want distancing to have a greater emphasis. They want face coverings to be an expectation inside schools. Does the Cabinet Secretary not recognise that there is a case for erring on the side of caution?
Cabinet Secretary.
Well, I think, fundamentally, I think the government has erred on the side of caution in all of our actions in relation to COVID, and indeed we have been criticised on many occasions by many of the people over here for erring too much on the side of caution. So I'm not paying particular attention to what's been muttered behind my back over there today. So the substantive point that Mr Harvey raises is one that I hope I've adequately set out to Parliament that we are considering, that there will be arguments about whether or not the measures are appropriate at the present moment. We've sought clinical advice. We will continue to seek clinical advice to inform the judgments that we make. But based on the evidence that I have so far, none of the positive cases appear to have emanated within schools. It is the other way around. They've emanated in the community and gone into the school with a pupil. We obviously have to concentrate our efforts on ensuring that we have a safe regime within schools, but also that we are doing all that we can to suppress community transmission, because by suppressing community transmission, we will give the best prospects of our school hygiene measures being as effective as I hope they will be.
Thank you. Question number 3, Gillian Martin.
Presiding Officer, to ask the Scottish Government how it's assisting in the aftermath of the train crash near Stonehaven.
Cabinet Secretary Michael Matheson.
Presiding Officer, our thoughts and condolences are with the family and friends of those who have lost their lives and those who were injured in the tragic rail incident near Stonehaven. Scottish Government officials within Transport Scotland are liaising closely with investigating bodies and the rail industry. In addition, I have met with Network Rail, Abellio ScotRail, the Office of Rail and Road, the Rail Accident Investigation Branch and the emergency services and agencies who dealt with this tragic event. Transport Scotland has also supported the Abellio ScotRail to ensure connectivity to Aberdeen is maintained by bus replacement. Transport Scotland senior officials also participate in regular calls with industry partners to discuss the derailment situation and the recovery arrangements.
Gillian Martin.
Thank the Cabinet Secretary for that answer. I'd like to also put in record my condolences to the families of those who lost their lives and were injured, and thanks to the emergency services. An assessment of the condition of the line and surrounding area will be of the highest importance, and passengers and railway staff will want to have full confidence that everything has been done to ensure the safety of the rail infrastructure and the embankments along the line. Can the Cabinet Secretary give some more detail of what work has been carried out in that regard?
Cabinet Secretary.
Presiding Officer, in addition to the ongoing investigation underway by the Rail Accident Investigation Branch, Police Scotland, BTP and the Office of Rail and Road, Network Rail has been asked to provide an immediate assessment of any similar risks elsewhere across the wider GB network, with an interim report expected by the 1st of September and a full report later this year. Additionally, from my discussions with the lead investigators of the incident at the RAIB and the ORR, any factors identified during the course of their ongoing investigation, which they believe need to be brought to the attention of rail authorities, will be identified early and brought to their attention in order that immediate action can be taken.
Gillian Martin.
Once again, thank the Cabinet Secretary for that answer. The events of last week continue to be extremely traumatic for survivors and the families of those affected, and will also have been difficult for the emergency services who attended the scene. In addition, I've had a few constituents who work on the railway get in touch with me to say how upsetting they have found the approach of the reporting of the tragedy in the Sun newspaper and the insensitive doorstepping of families of the victims very quickly after they were receiving the devastating news. Can I ask what support those affected are being given to help them?
Cabinet Secretary.
Presiding Officer, I am aware of insensitive approaches which have been made towards families and victims who were affected by the rail incident of last week, and these are completely and utterly unacceptable, and this Government does not condone this behaviour in any shape or fashion. I would hope that those who have been involved in making these insensitive approaches would take a long, hard look at themselves and to recognise the sensitivity of this particular matter. I can also advise Gillian Martin that Abellio ScotRail has met with the families of both Brett and Donald and has offered support. In addition, I also understand arrangements are well advanced by the rail authorities to offer passengers' families affected by the incident support as well.
Thank you. Liam Kerr, to be followed by Lewis MacDonald.
Thank you, Presiding Officer. This tragic accident, which is nothing short of a disaster, has had a massive impact which extends well beyond the toll last Wednesday. So, following up on the previous question, Cabinet Secretary, how is the Scottish Government assisting third sector organisations to deal with the friends, families and colleagues across the North East and beyond affected by this incident?
Cabinet Secretary.
Presiding Officer, as I mentioned in my response to Gillian Martin, the rail authorities are already taking forward work and working with appropriate agencies to provide support to those families who have been affected by this tragic incident. However, of course, if the member has a particular third sector body who has been involved in this matter that requires assistance, then I'd be more than happy to give consideration to that. But I can assure the member that assistance is being provided where it is sought and that the rail authorities have put arrangements in place to ensure it's provided.
And Lewis MacDonald.
Cabinet Secretary will know that the men and women of the railway family across the network will be marking 1 week since this disaster with a 1-minute silence at 9:43 tomorrow, and those affected will be in all our thoughts at that time. Can I ask whether he agrees in principle that the rail disaster near Stonehaven should lead to accelerated investment in improving the safe running of trains between Aberdeen and Dundee, and must not result, however inadvertently, in any avoidable delay?
Cabinet Secretary.
Presiding Officer, the member raises an important issue, and it would be wrong for me to try and preempt any of the investigations that are taking place at the present time across 4 different agencies. The member will also appreciate that the operation, maintenance and the renewal of the rail network is a regulated matter, regulated by the Office of Rail and Road, and they make determinations every 5 years as part of their periodic review process of any operational maintenance and renewal matters that need to be taken forward, including safety, that have to be taken forward within a control period. Clearly, depending what the outcome is of the various investigations that have been taken forward, it would then be for the ORR to look at whether further determinations need to be made to Network Rail for further enhancements or maintenance or renewal works to be undertaken on this particular line. However, at this stage, it is too early to say what the exact causes of this incident were and what measures need to be put in place to prevent an event of this type from occurring again in the future.
Thank you very much. And that concludes topical questions. We're going to move on.